is that the tissue near the surface of your head gets the full rate of radiation and it absorbs some. As the beam goes deeper, the next layer also absorbs some radiation, but less than the surface. That's because the surface has already absorbed a bit of it. When the beam arrives at the tumor, it's already been partially absorbed by the layers closer to the surface. That means that the surface tissue gets more damage than the tumor itself. And, of course, the beam doesn't just stop at the tumor. It continues on through the brain, and some of it might even come out of the other side of your head. The brain tissue after the tumor gets a reduced dose of radiation, but it still gets some. The way they do that is they move you or the beam so the beam goes through a different path through your head. That way, one treatment hits one spot on your head surface, while the next treatment goes through another. However, every treatment goes through the tumor. Over the course of multiple treatments, the tumor gets hit again and again, with the other tissues getting hit only once. The goal is that the cumulative dose in the tumor is higher than the other tissues receive. It's actually quite clever. They lose their energy fairly slowly for most of the passage, but then lose a whole bunch just at the end. This is called the Bragg peak, if you want to look it up. It's kind of like when you're slowing your car down for a stop sign. It's smooth going until the moment when the car actually stops, and then the back of the car settles down and you get a bit of a jerk. We can see in this image what this means in terms of energy dose. Here, the surface tissues receive a lower dose than the tumor does, and further, the beam doesn't continue on through the head. So this sounds like a great approach. And of course, you can do the trick of shooting the beam at the tumor at different angles. This means it's possible to hit the deep tumor hard with much less damage to the surrounding tissue. I've even used it to irradiate electronics to see if they would work in a high radiation environment. Now, I want to remind you that I'm not an MD and I'm not a radiation therapy specialist, so don't take any of what I said as medical advice. Specifically,
one of those kind of doctors who actually is useful.